afternoon, depending on where you are in this world. I'm coming to you from our offices in New York at a terrible time confronting our nation's public health history. I realize I do not need to go into the details of COVID-19. The association was founded in 1984 and then made into a national organization in 1991. We represent over 1,100 opiate treatment programs through our 30 state chapters, and we work with all the associated federal and state agencies which have jurisdiction in this particular area. Our goal from the beginning, and continues to this day, is to expand access to quality treatment services for people with opioid use disorder. We will detail our accomplishments in 2020 and give you an idea about what we plan to do in 2021. So please be as generous as you can in considering making a donation to ATOD. I realize that we are coming to you at this day with a donation request amidst a terrible time in our country's history. Not since more than 100 years have we experienced a national public health epidemic as we have done since March of 2020. I know that our opioid treatment programs have been open, serving patients throughout the United States, facing terrible challenges. We also recognize that this has been a difficult time for our patients to get to treatment, and we have worked with the federal and state authorities which have jurisdiction in this area to make treatment continually available in spite of the threat of COVID-19. As I ask you to consider making a donation to ATOD to continue our work through 2021, I think it's useful to review some of the accomplishments of 2020. One of the most significant was implemented on January 1st, 2020, which was the first ever Medicare reimbursement rate for OTPs when the programs are treating Medicare eligible patients. This was years in the making, but was finally approved as part of the Congressional Omnibus Bill of October 2018. We immediately began working with CMS Medicare representatives to create such a rate, and I have to say that the Medicare representatives were wonderfully helpful in getting to the rate which was implemented this past January. The programs are still going through the enrollment period, and we hope that by the early part of 2021, all of the OTPs in the United States will be enrolled as Medicare providers. I think the second major accomplishment was dealing with the DEA. They are terrific federal agency partners to ATOD. And I can say this because they have now issued the regulatory requirements for operating mobile vans connected to the OTPs. The final rule will be hopefully promulgated before the end of the current calendar year or during the first quarter of 2021. Giving you an idea of what our major accomplishments were in 2020, now let me go into what we plan to do in 2021. I'll begin with our work under the Opioid Response Network initiative and focus on 3 projects. The first is going to be in partnership with NASDAD, the National Association of State Alcohol and Drug Abuse Directors, evaluating the patient census and opiate treatment programs throughout the United States. We'll begin this on January 1, 2021, in conjunction with the state opioid treatment authorities and certainly the opioid treatment programs themselves. This will also include what medications the patients are taking as of January 1, 2021. Period. This kind of census check has not been accomplished for many years, and we believe that will mark an important territory as we expand access to care within the opioid treatment program setting. This is also going to be a segue into increasing the blueprint of OTPs throughout the United States, and we anticipate that the DEA mobile van regulations will be finalized so that we can encourage both the SOTAs in the United States and treatment providers to develop new licenses to use the mobile vans as an extension of the OTPs. We expect that this will expand access to care in rural and suburban settings of the United States, in addition to the vans being utilized in the criminal justice system, particularly correctional facilities. Also, we will continue to follow the implementation of Medicaid reimbursement rates throughout the OTPs now that the entire states, all the systems, have Medicaid reimbursement when the OTPs are treating Medicaid-eligible patients. We're certainly going to continue to work to develop telehealth, and that's the second of the ORN initiatives. We think this is critically important, especially what we've learned about telehealth and telephone communication between OTPs and their patients during the age of COVID-19. Also, we plan to continue and increase our work in the international system, working with member nations of the United Nations and working to expand access to care wherever is needed in the world. We're also going to continue to work to preserve the confidentiality protections of patients in treatment as we pass through what we certainly hope will be the end stages of COVID-19. So we look forward to our work in 2021, and again I ask you to be as generous as you can in making such donations. So I'm going to ask you to visit our official website. Certainly go to the link on the donation program, and this will guide you on how to submit a donation. Keep in mind that you can be listed on the website as a donor if you so choose. You can also opt to join the President's Club, which is a $1,000 donation. This will also give you continued access to reports from our offices in New York to keep you informed throughout the year. So thank you once again for considering making a donation. As I said at the very beginning, I realize this is a demanding and incredibly challenging time. We wish you all from our ATOD office, from the Board of Directors, a very pleasant, peaceful, but safe holiday season. Thank you again for considering this.